award. There's a small certificate that goes with it. And, of course, the Huiskes medal, which is inscribed with your name. Once again, congratulations. We would have a few minutes if somebody has a question for Professor Claes on his work. 1 or 2 questions, if you like.
This was an amazing talk. Really enjoyed it. Just trying to extrapolate on what you were talking about, the fracture gap and stiffness. Would I be right if I were to say that, look, if I further reduce the fracture gap, then you would require an even stiffer system? If I further reduce the fracture gap, then would you require an even stiffer system?
If you have no fracture gap at all, if you have no fracture gap at all, it can be critical because any small movement will create a tremendous strain. So then you probably create a bone resorption. And the resorption goes on till the gap is so large that the strain can be stand in this region. Yeah.
Thank you very much, Lutz, for this very elegant presentation of your work. I'd like to ask you a bit about the future and how those models, numerical models, can be used in the clinics, and you've alluded to this, but you've very nicely showed that, we are able to now model quite generic fractures quite well, I think. And maybe I could argue that, next step could be to model very unusual fractures, multiple fractures or very large gaps. So that it really helps the surgeons actually to get a better treatment. But I was wondering what was your view on this, for the future in terms of clinical application?
Yeah. The first what we learned, I think that can be took off there. Make it. There's some additional at the end. Okay. The first what we learned is a fracture seldom comes as a fracture alone. So there is often soft tissue damage, or you have a contusion of the lungs, or you have a patient who has an illness already and get the fracture in addition. So all this what I have shown is more or less true for a healthy young man who has an accident, but not for an elderly with some other illnesses. That's, if we would like to take this into consideration, it's really going to be very complex. And that the same is true for biological processes, which we cannot qualify or which we cannot describe good enough. And the problem with the biological processes often simulated now is how to calibrate this. What we found on a more clinical point of view, we did some studies with different injuries additionally to the fracture. And we can say as higher the injury level is, as more stability you need. So that is what we can say at the moment for the clinic, because they say, okay, you calculated that for a young man with a simple fracture, but what about my patients? So if he has an infection or if he has a soft tissue damage or whatever, then go to the stable side. It's a safe side. Huh?
Okay, with that, I would like to close the session. Of course, if you have further questions for Professor Claes, take advantage of this excellent opportunity to find him at the next break before the meeting ends. And once again, congratulations and thank you very much.
Thank you.